I'm also really looking forward to the ICHOM 2026 conference, and it's really the one place where we just focus on patient-reported outcomes, where we all come together, no matter which disease area that we're focused on, to have this multi-stakeholder conversation between everyone who is involved in patient-reported outcomes. People living with the disease, the clinicians, the researchers, the statisticians, industry, and universities all together, and I think ICHOM 2026 will just be this great melting pot of ideas and innovations and outcomes so we can all learn from each other.
In terms of 2026, I think we'll see even more patient involvement, and especially that it's done in Quebec next year in Montreal. There's a huge movement in Quebec with patient centricity and patient involvement and alignment in terms of vision, strategy. When we're deciding what's the plan, for many organizations there is a lot of patient involvement, patient-led kind of experiences. So yeah, I think it'll be really important to see that happen for everybody in the community, in the international community, of there's a way and there's examples that we can kind of be inspired by and bring home.
I think you have to build on success, you have to build momentum. So when you have these events, you have to continue and bring people together again. And learn from what have you learned in the interim? What has been your experience in the interim? Because that's the learning. I think it's important to have all stakeholders. Patients are critically important. We need to bring the clinical community along with us as well, and we need to bring innovators along with us. Also, I think there can often be a gap in understanding in relation to, for example, why we're looking for better outcome measures across the board in all aspects of healthcare. And we need to bring the people who are really close to the clinic or developing innovations with us on that journey. So, there needs to be an equitability around that as well. And that leads then to more broad consensus in what we are advocating with, gives us the better tools to advocate with much more purpose and much more of a community. And I think that's really what's important going forward.
I hear the priority is bringing much more involvement, and I think that's wonderful. I'm Vice Chair of IAPO, which is the International Alliance of Patient Organisations, and I think partnering with people like that to ensure that you are bridging out to all those patient organisations to get them into the room is essential, and I think 2026 plays a great opportunity for that to happen.